Thank you. I'd like to introduce you all to the Spitales, and we are privileged that they're here with us today, and they'll be joining me up there in a minute. Marianne and Frank and their daughter Andi and their middle daughter Nicole. Marianne and Frank were teenage sweethearts, and they've been together since they were 16. They were married in August. They'll be married 48 years. Andi is the youngest of their three daughters. Andi was born with Smith-Lemli-Opitz, and I'll let Marianne tell us about some of that. That's SLOS disorder. Marianne and Frank have done an extraordinary job of caring for Andi, and we can all help wish Andi her 35th birthday in August, so she's going to celebrate that. And in that sense, because of the good care that she's had with their parents, Andi represents for us that type of person who is living longer with disabilities than we've seen in the past. And so that is a very special testimony to the care that she's had. Frank retired 3 years ago after 40 years of being a pharmacist and actually leading a pharmacy in a local hospital. And they were in Michigan. The family chose to move to DC area to live with their middle daughter, Nicole, who is both a policy person and a builder. The move was generated in the face of Frank's worsening health and their family's shrinking resources. Although appreciative, they've reluctantly done this move to DC, and in the fall of 2016, they left behind all their supports and family and a lifetime of connections in their community. Marianne and Frank are sharing their journey with us today to help highlight the fact that the lack of access to coordination of supportive services jeopardizes their health and well-being, as well as making it challenging to keep Andi stimulated and happy. I'd like everybody to be listening to the themes that we're going to present, sort of no access to the information when they needed it, no really response from the system, no return calls, no return emails, guardianship that's not transferable, which we may or may not get to, no caregiving support training, which fortunately, because of Marianne and Frank's ability, they didn't need in the way other people would, and that their conflicting rules and the lack of social service and support really has taken a toll on the family. So please, join me up there. Marianne, Frank, and Andi, and Nicole, welcome. I gave, is this funny? Yep, it does seem funny. It seems funny, I think, to all of us. And Marianne is one of those wonderful people in life that, I'm sure everybody is aware of this. When somebody says, well, who can do this, or who can get the chairs, or who can file the report, and then there's silence, and you hear the deafening of nobody answering. Marianne is a person who steps up and says yes. And so at that point when I heard, and I think people who have been with us through this roundtable series knows that we have been really important to us to have it start with a family who's had the experience that we're talking about. And so when I asked Marianne, she was willing and said yes. And I'm delighted that Marianne and Frank and Andi and Nicole are here with us. And so just first, before we talk about some of the other specifics, tell us a little bit about the journey that got you here. We'll ask Marianne first and then Frank.
Okay. We wrote a bunch of notes, but I don't know what we wanted to say.
Well, you'll figure it out. Just say how you got here.
Right. Well, first of all, we moved from Michigan in September of 2016.
There you go.
And we
see if it's.
We needed to.
Yeah.
We needed to move because I was worried about taking care of Andi and Frank now because his health had really declined, and financially we did not save well for retirement. We were in that situation, and our beautiful daughter, who is here today, we're going to get all emotional, but Nicole, who's sitting right there, was generous and kind, and she and my son-in-law both took us in and built a nice addition onto their home. And yeah, you have to like ice cream. There you go. Okay. So at any rate, we moved, and we knew there might be a waiting list to get services for Andi, but the three of us were on Medicare, so at least we had that. We had the health care. But in Michigan, Andi had, day programs and extra things that were all just covered because they gave her the additional Medicaid in Michigan, even though she was an adult and on Medicare. And so when we moved in September, we right away went and applied for this insurance, but we were declined because her Social Security is a little bit over. I don't know. We did not hear exactly what was the amount that she had that wasn't working, so she could get the extra Medicaid. But we persisted because. She's a really good girl, and she's very content. She's very happy. She's non-verbal, but she lets us know what she wants, as you can see. And but the 24/7 is a lot of work. She's total care, and she's needs G-tube feedings, stomach tube feedings. And so we persisted, and with trying to find extra help. We looked into day programs and things like that, but the price was prohibitive. We wouldn't be able to afford, sending them there. We did hire some LPNs to come in and helped out for a couple hours here and there, but we're still running out of funds. And
was that feeling stressful?
Yes,
right.
As you can hear,
right.
As you can hear in my voice, I did kind of fall apart. Frank had hospitalizations and illnesses, and we'll let him tell.
Yeah,
we can let him tell you about his health. But it's a lot of running around to doctors and back and forth, and then trying to do the day to day. I fell apart. Our addition to the house was still being built, and all the pounding and things got to me, and I ended up just screaming at everyone. I asked for help, and luckily I ended up on Judy's doorstep, and she has helped me for the last year and a half, and I'm able to cope to keep on persisting and getting help for Andi. Eventually, Medicaid said whether she could be on a spend down program, and we should save receipts for 6 months, and if she spent 75% of her check on medical bills, she would qualify for spend down. We never got the explanation of what the spend down meant. So we did save the 6 months of receipts and turned them in, and then we waited another 2 months, thinking it's probably going to take 3 months, and then we're going to get a check in the mail, and we'll be able to buy a day program for her, that buy services and nurses and things like that. But we got no response, and we had a caseworker and kept calling and calling his office, leaving messages, tons of messages. Finally, I got him on the phone one day and asked, where's our check from the spend down? And he said, I don't even know how the spend down works. And I said, do you have all our receipts that I turned in? And he said, yes, I have it all here on the computer. And then he said, so let me talk to my supervisor and I'll call you back. And of course, I thought he was going to call right back, that day. I waited another 2 weeks, and then we called him to say, we're coming down to talk to you, and just did that. And so the three of us showed up at the office to talk to him.
Let's let Frank say a little bit about himself, and then we'll go also back into some details about that journey, which has been, 21 months now?
21 months to get service.
I even took a picture of him just to make sure that he was alive.
He thought he was just a voice on the phone, voicemail.
Right.
So Frank, share with us a little bit about your journey that got you here to Maryland with Nicole and your family.
Well, financially and medically, speaking, this is what expedited us moving here quicker than the house was ready. I just want to make one thing about Andi. Her Smith-Lemli-Opus syndrome is inability to make cholesterol for her body, and that's what causes all the different things that's wrong with her. Have congestive heart failure, COPD, rheumatoid, and osteoarthritis, diabetes. All this came up in the last couple of years. And it's been stressful on my wife. When I hurt my back, she's been having to do all the heavy lifting of Andi because our lift doesn't work too well. Pneumonia doesn't help either.
Chronic pneumonia.
So, Marianne and Frank, what are the things that surprised you when you came to this area after having the years of help and friendship in Michigan?
Besides the humidity? I'm supposed to be the comedy relief.
Which he is. So the journey that you went on for getting the services, Frank, where did you fit in that? Did you help with some of the calling and the emailing?
Yes.
Filling out application after application.
Oh, so many applications for every department in the DDA.
And how many people, and this we don't want to give away the end at the beginning necessarily, but how many assessments did Andi have along the way?
I think just coming to the house, we had 5 people, five, and they were a month apart, where people kept coming to assess us. At the same time that we applied for Medicaid, the health department does have a wonderful department, the Developmental Disabilities Administration, and I have to give them props because that is very specific to helping persons like Andi. And but their process, we were waiting to get a waiver from them, and their process is very complicated. And you fill out one application. They assign you to a service coordinator that is someone that they contract the services from, the service coordinating company. And they called one day and said, Andi has the waiver. And the next morning, they called back to say, no, that wasn't correct. You have to fill out another application. This is like the 6th or something application and apply for the waivers, a specific waiver. And it's just maddening, when you're waiting, and where we're up to then, we were up to about 18 months of waiting to get any extra help that would be paid for, just with these day-to-day things.
In those 18 months, and I think this is where it comes in that Frank was no longer able to help as much as he was able to. When did it dawn on you that things were different?
Things were different when I fractured my thoracic vertebrae.
How did you do that?
Lifting Andi from the bed to the wheelchair. I just barely got her back into bed, and then I called her. And she was at your office. I says, you better get home. I says, I did something to my back. And I haven't been able to pick her up since. And it's over 14 months ago.
So that means, Marianne, it's been 14 months except for the handful of respite pieces that you've found and what you've been paying on your own, that Marianne's been our sole caregiver here.
Yes. I feed her, I change her, but she still has to do all the lifting.
How has that been for you, Marianne? Are you able to get out of the house and do things?
No, you kind of get, you're a little bit too tied up. And if I do have a free time when we hire a caregiver, you just want to take a nap. You're just ready for a nap. You're not ready to go out and do anything. So yes, we have to work on that. I guess we should tell them the end of the story, though. It has turned out happily because we have the Medicaid, and we also received the DDA waiver, which is paying for day program and in-home help for. Actually, some of the DDA waiver, we did get the day program, but we're still waiting for respite help, and it's still frustrating because it takes so long. But we did get the services, yeah. And I guess we just needed someone to organize it, a social worker, or someone to look into. Andy's got this health problem. Frank has that health problem, and we need help at home. This last hospitalization for Frank, he had a pneumonia and ended up with sepsis, and he was so weak after he was improving with the antibiotics, but he was so weak he couldn't stand. And this time I knew to ask, that he needed home care when he came home or something, and they did provide it then. But families shouldn't have to ask. We don't even know what we need. That when the hospital or someone has to present these things, make it a little easier on the families.
If you were in Michigan, although I know Nicole and her family have been very helpful, where did you have the connections in the hospital or other friendship networks that would have been helpful that you've been using for all these years?
Right. I think with Andi growing up there, it was the school system, and the school social worker was always there. When we needed to apply for guardianship when Andi turned 18, it was the school social worker that went to court with us. Now we were on our own and had to hire someone here in Maryland when we needed guardianship, and they charged $3,000. First they said it was $2,000, but then they had, I guess, with a little bit of complications or whatever, so the bill came to $3,000. Even though we told them we could only do the $2,000. Why would you charge parents? I don't know. The court did appoint an attorney for Andi, so she did have her representation. But to represent her parents that want to continue taking care of her, we had to go out and get a lawyer. This is the same with the applying for Medicaid and DDA waivers. They really can't talk to you as parents of a person that doesn't have a voice. So we have to have legal guardianship for her to start all of that too.
Frank, did you have help through the hospital records where you were for your own health?
Did I say
Did you have
I'm
connections?
also deaf.
Oh, we forgot to talk about the cost of the hearing aids that you were telling me about.
Right.
And the drugs.
Well, insulin, as some of us know, has gone up in price so high, over 3,000% for a little vial. And all my inhalers for my COPD are astronomical.
25% of our combined income. 25% of our combined income goes for co-pays on medications a year. 25%, and that's not counting medical, the co-pays at the doctor's office or anything. That's just medication. So we're really asking for some help in changing those prices of prescriptions. They're still outrageous. And when we moved here, we had to apply for new Medicare, and we shopped around and around, and we did go with Kaiser, and because they were paying better for the prescriptions. I don't know if that's a good way to choose your doctors or whatever, but that was what we had to
The
do.
doctors have been very good there.
One of the other things you said to me, Frank, that you liked about Kaiser was about the records,
The
right?
records, they were able to access at Suburban Hospital all my records from Kaiser, all the meds I'm on, all my past history, and that helped a great deal for them to diagnose. And I like that.
You think something like that would have helped with Andi as opposed to her having the 5 assessments?
To have them all look at the same screen would have been great, because we'd only have to fill out one set of applications, and they could share. There should be a form to indicate that, yes, please share with other departments for Andrea, or something to mark that we give the okay for them to look at her past history.
How was it when people would come to the house? That was at the end of these 21 months now? How'd you have the different people come in and out, or for the assessments?
The assessments, yes. It seemed like I said, there was once a month for the last 5 months where someone would come in. I mean, all these different departments were part of the Maryland Health Department, and they had access to the records online. But it seems like they just start all over again with, fill this paper out with your name and address, and then going on from there. And when you don't think it's going to end up in getting any help for you, you're just really tired of answering another question. And I was very persistent, but I can see where a lot of people would not, would just, maybe, I don't know, maybe that's the point, because there's not enough funds. They want us to give up and, not apply for Medicaid.
And without the help that you had in the past, it was slow to dawn on all of us. I think that, Marianne, you weren't getting to some of your exercise classes that you'd done in the past.
Right, just getting out. You don't realize it. You lose contact. It's like I said before. It's just too hard to try. If you have a spare minute, you're too tired. You're too tired to go out and do anything. So. Thankfully, Judy's helping me with that problem of mine to do now. But if we had gotten the help that we needed when we moved here, it might have made a big difference.
A little less stressful.
Yes.
And how did you cope with the stress when Frank was in the hospital?
I don't know. I don't know how you cope. I think when you're in the crisis mode, you just you can push ahead and you just keep going. And we've got we're very lucky because we have my daughter Nicole and her husband, that when we had to whatever we needed, when we had to drop things and go to the hospital, that we have her, and she has to drop her work and whatever she's doing to help us too. So we've been worried about you, Nicole, too, that it's been too much stress for the whole household.
And one of the things when you mentioned Nicole, which is wonderful, that a lot of other families wouldn't have the benefit of. Tell us a little bit about what Nicole has designed for you. Frank, it looked like a beautiful place.
Oh, yes. It's an in-law suite with 2 bedrooms, a family room, kitchenette, and a roll-in shower for Andi. The entire area is built for Andrea. No steps, no ramps, anything. On the outside is the ramp. So it's easy for us to get her outside, down the ramp, into the van and roll and shower. We had to purchase our own shower chair for her that rolls.
Would it be helpful to you if somebody had paid for a rolling shower chair?
That would have helped. Consider it's over $900 for a rolling shower.
So
Yeah.
those are some of those hidden costs that other people are not really aware of.
Yes.
And the type of housing design that Nicole has developed for you is unique and something that would be helpful, I would think, in general, yes?
Yes. It's beneficial to me too. That I don't do too well with steps. So this helped me too.
So we have the housing design that's critical for your lifestyle that keeps you both sort of healthy and independent and good for Andi.
Especially when the gurney came from the ambulance. They just rolled it right in and rolled me right out. And I didn't know what was going on.
This is where we promised that Frank was our stand-up.
We were saying, though, that it would be nice if you when you add these things onto your home, if there were better tax breaks. I think the county has something, but our daughter, when she looked into it, there are so many requirements that you can't just say, well, we spent this much on a ramp or whatever. It's got to be a certain kind of ramp, and if you don't have 2 ramps, one in the front of the house and one in the back of the house, you didn't qualify for the tax break. And so it was.
And how's the van doing?
We're lucky. We're probably on our 3rd van with Andi. They last about 10 years, and we purchased the. You have to take it to be converted so that you can get a wheelchair on and off easily, and that cost is at least $20,000, maybe higher now. And actually, with the new waiver that Andi has, though, the DDA waiver for community, the money in there you can kind of self-direct. And if we said we wanted to use it instead of for the day program or this or that, we could use it for a van conversion and stuff.
Did you have that kind of benefit in Michigan, or
we did not have that in Michigan.
I
No.
just took it off the taxes.
Okay, good. So is there anything else that you and Frank want to highlight for us, or maybe Nicole? Because then I think what we'll do is we'll talk a little bit about some of the solutions that we're thinking would have helped you. Anything else you wanted to share with the audience first, Frank?
No.
No? Okay.
I think we're going to let you do the solutions, Judy, that we gave you. Okay.
Well, you got to say the last one.
What was the last?
You just told me that you surveyed your caregivers group.
Yes, just briefly last night, I surveyed one of my Facebook caregiver groups and asked, as family caregivers, what do you think our government should do for you? And I got 12 responses, 1, 2, 3, and out of the 12, 8 of them asked for Medicare for all. There are some spouses that are taking care of a spouse, and they're not old enough for Medicare, and they don't have any health insurance. They're asking, what about spouses that stay home and take care of their spouse? But we don't want our loved ones to end up in nursing homes. And we can't afford that either. So there needs to be someone paying attention, because more and more people are living longer. I don't think we were prepared for this. I do have 2 friends, one in Canada and one in the UK, that have children with the same syndrome as Andi. And when we told them some of our situation, they said they sympathize with us because they don't even think about health care. They just walk to the doctors and go, make an appointment. They sympathize. They would never be able to handle taking care of their special needs child and fighting with insurance. And the friend from Canada says, please don't tell all your friends because they're going to want to move here. She has a daughter about the same age and same condition as Andi, and she chose to put her in like an assisted living. But I asked, well, what do you have to chip in every month for that? And she said nothing. They're taking care of assisted living, and her daughter still gets a Social Security check that covers like her personal items and things. There's no charge. So it seems like we're really, really behind here. We do need at least Medicare for all.
I didn't even ask her to say that. I worked on President Carter's national health insurance, so it wasn't called Medicare for all then, but that's how old I am, Marianne. You didn't know how old I was. And so Frank, tell me a little bit about how you think maybe some coordinator would have helped with all of this 21 months of waiting.
I don't know.
We're just too frazzled. We're just too frazzled. It would really help if we had someone we could have turned to that would have been maybe not part of the health department, but in social work, so that they could direct us, go to this office, go to that office. Actually, at one point when we were irritated about not getting the Medicaid, Nicole came with Andi and I, and the service coordinator that we have that's working on the DDA. You can't have a DDA waiver until you get the Medicaid first, she told us. She directed us to an office, a different office, not the one that our caseworker was at. And we'd gotten a lot of false information, and we went to that office, but they couldn't help us, because once you're assigned a caseworker, you have to stay with that person, and it's just a lot of false information. If someone that knew what's going on and how the system works, I guess, to get help, it would be really helpful.
He's been very ineffective.
Talking about our caseworker.
The caseworker.
Yes.
I think that's an understatement. I mean,
the day that Nicole and Andi and I went to that office we were hoping like we could apply for Medicaid all over again, and we requested a different caseworker because we said he was just not available and overworked, but the person in that office called our caseworker. He wasn't there that day, and so we talked to his supervisor, and the supervisor would not help us at all. He said he would just have our caseworker get a hold of us. That's it. He wouldn't look at our information online or anything. Couldn't give us any information. And this is us bringing Andi over to the office, and then you get no help, and then they instruct you to wait for a phone call from your particular caseworker, and he's your caseworker because your last name starts with S, and so that's it. There's no other choice. There's no other choice. So we know that these departments are overworked, have too many clients, and I guess that's part of it.
and that's one of the reasons that we think Frank took a picture of the guy, but we wouldn't put it up here because of HIPAA compliance. So Marianne and Frank and Andi and Nicole, thank you so much. And they are all open and willing to take some questions from the audience. If anybody had any questions that they'd want to share or have some information.